Can deri deri spini var. Kabul can deri deri spini var.
The health in Pakistan and Afghanistan is poor at best. There are not enough health facilities to support the ever-growing population. There are approximately 200 million people living in those two countries alone, but nowhere near enough medical facilities to support them. Most of the diseases the people in this area of the world suffer from are treatable or preventable, but due to the poor economic structure of the regions and the remote locations of many of the communities, the medicine and vaccinations to treat these illnesses are not available. A large contributing factor to a lot of the health problems is poor sanitation and a lack of clean drinking water. Some of the most alarming statistics are the high death rate of children under the age of 5, pregnant women, and miscarriages. According to the World Health Organization, 100 out of every 1,000 children that live through the birthing process die before the age of 5, and 500 out of every 100,000 pregnancies are lost before full term due to health problems. The mothers of these children do not fare much better. According to USAID, between 350 and 550 out of every 100,000 mothers do not survive their pregnancies. A large contributing factor to most of the deaths of babies and pregnant women in the region is lack of trained professionals to supervise the birthing process. Due to the lack of proper training facilities and hospitals for these medical professionals, most of the deliveries are done at home. According to USAID, 66% of the births are done outside medical facilities. Many of the diseases that claim the lives of the people in the region are treatable or preventable. The leading cause of death are disease caused by poor sanitation and lack of clean water. With these living conditions, staying healthy is a constant struggle. Infections of all types are common, and the most prevalent being respiratory infections. According to USAID, 60% of the deaths of children under the age of 5 are contributed to malnutrition and diseases like diarrhea. That's 230,000 child deaths per year nationally in Pakistan alone. Other diseases that are prevalent in the region include malaria, tuberculosis, polio, pneumoma, and measles. Most of these diseases can be prevented through immunizations, but lack of proper medical infrastructure in the remote locations of a lot of these people make it very difficult, if not seemingly impossible, to get the proper medical care to the population. Most of the world takes for granted the services we have available to us. If we get sick or hurt, help is just around the corner, or on the way to us in minutes. We walk to our kitchens, clean drinkable water is there at a flip of a wrist or a turn of a valve. We have hot baths regularly available to us and have clean clothes to wear. The sicknesses that inflict so much pain and death to the people of Afghanistan, Pakistan, and the people of the region of the world are now just a bad memory tucked away in our past history. Most of us are under the impression that we find a cure for disease, that these cures are available to everyone, and it's just not the case. Diseases like tuberculosis, polio, measles, and malaria have been treated or done away with by simple injections or pills. When politics and money are involved, things are not quite so simple. The lack of funds and poor governmental infrastructure has made the health of the people in this region of the world spiral out of control. There are positive things happening in the regions. Organizations like USAID and the World Health Organization have made a difference, but is it too little too late? Will the rest of the world follow suit, or will we turn a blind eye to the problems of these people because we think they don't affect us? Whatever we do, it won't bring back the people that were lost, but it could stop more from dying senselessly from diseases that could be abolished from the face of the earth by something as simple as an injection, never to take another life.
Balti homes are normally made from river cobblestones cemented with mud or sun-cooked bricks. They are divided into a winter level and a summer level. The winter level, or kaza, is underground without windows. The summer level, or balti, is the main room of the house. The house is divided into 4 different areas: one for the children, one for the men and guests, one for the matron and elders, and one for the women managing the kitchen. Water for drinking and crops must be collected from contaminated glaciers or from sewer streams which run through some cities. Water sources are scarce, and women carry the water back to their homes. Due to the scarcity of burnable wood, dried yak dung is the main source of fuel for fires used to cook and keep people warm. Large families live in the same house. Each person has a certain job around the house. Even kids help out. There is not much privacy, and there are usually no empty rooms.